Hello, my name's Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 15th of December 2021. If I start with the in-hospital numbers, today we're showing 20 positive inpatients with 13 on our general beds, 4 patients in critical care and 3 patients at Clifton. So these are patients who are within 14 days of their first positive diagnosis. And there's another 22 patients across the trust who are in hospital because of COVID, though they're beyond 14 days. That number, that inpatient number, has stayed pretty stable now for a few weeks, and you'll remember that our COVID numbers were higher in October and November. So let's have a look at the community numbers, and then we need to think about the new Omicron variant and what that means for us. So community-wise, Blackpool is showing 310 positives per 100,000, and last week that was higher at 408. Fylde is showing 356. Last week it was 326, so it's gone up a little bit in Fylde. And for Wyre it's 291. Last week it was 279, so a little bit of movement there. The national average at the moment is 537 per 100,000. So the Fylde coast is a little bit lower at the moment than the picture across the rest of England. The worry, of course, is the new Omicron variant, and the main concerns about Omicron are its ability to spread very, very quickly, probably more quickly than the other strains, and also a question mark about just how effective the first vaccination programme has been against it. And what we know about the vaccination programme is the booster is incredibly helpful if immunity is starting to wane. So now for any adult over 3 months since their main course, it's a possibility to get a booster, and that boosts the immune response to COVID generally and will improve both immune response to COVID and also reduce, though not eliminate, transmissibility. So the main themes are still, if you've never had a COVID vaccination, please come forward and have your first one. And if you haven't for whatever reason, never mind, it's still really important to get on and begin the course. If you've had your first vaccine and not had the second, please have the second. And if you're more than 3 months since you had those first 2, please come forward and have a booster. And our own trust site has increased the flow of vaccinations going through the hospital. The Vaccination Bus has boosted its times and locations across Blackpool, so that information is available on the Blackpool Council website. And of course there are many walk-in centres popping up for COVID vaccination, all of which are accessible through the NHS UK website. Subgroup still, if you are pregnant or you are hoping to get pregnant in the near future, the evidence is compelling for having COVID vaccination, so please do put yourself forward if you're in that category. We still are pretty good at testing across the Fylde coast. Our testing levels are high, so if you have any flu-like symptoms, please put yourself forward to have a PCR test, and again you can arrange that online. Asymptomatic screening really also important, so you can still get lateral flow kits from the chemist or online for free. There's been a little bit of an issue about availability, but I understand they are available. And if you're going to any public type meetings, great to check yourself using a lateral flow test, and in any case it's probably a good idea to do that twice a day. So then if you get a positive lateral flow test, you then go forward and have a PCR test to confirm, and that of course also helps to identify the strains. Still a big pressure on hospital beds, both here in Blackpool but of course across the whole system. And so in the run up to Christmas we're really focusing on trying to get people home for Christmas. We've started a campaign within the trust with mobilising all our efforts really to get people home for Christmas, and working with our colleagues in social care and voluntary care to do that as best as possible. The problem about about patients being in hospital who are really fit to leave is that the longer anybody stays in hospital, the more chance there is to pick up some other illness, and also to decondition really. So it becomes an unhealthy place to be once we've reached that moment where the hospital has done all it can in terms of medical care. And of course it also means that beds are restricted, so it's harder to get patients in through our emergency department, which remains very busy. So the essence of the Home for Christmas campaign is really to ask friends and family and loved ones to do everything they can to make sure that patients can get home for Christmas and be in their own environment and spend quality time with their families. Very last thing from me is that we've of course moved into level 4 NHS escalation now this week, and that's coincided with Plan B from the government. Key things about that really are wearing masks in public spaces, in regular lamp testing or lateral flow testing, and to work at home where possible, all in order to try and reduce the risk of spreading the virus. So I think we have to be really incredibly vigilant at this time. We will maintain our visiting restrictions, which isn't to say visiting is not available, but please check on the website before you come to hospital. And as ever, look after yourselves, keep yourselves safe, and also others. Thank you.